Hello everyone, I am Dr. Aparna Juneja and I am practicing consultant radiologist in RG Stone Urology and Laparoscopy Hospital in Faridabad. So today I am going to talk about prostatic biopsy. So as the name suggests, prostatic biopsy means taking biopsy from a prostate gland. Prostate gland is a gland which is found in males, and the normal function of the prostate gland is to produce a fluid which helps in the transportation of sperms. Now, as the age progresses, this gland increases in size, and sometimes this gland increases in size due to cancer. So in that conditions, to rule out cancer, we need a biopsy to be performed. So the main indications, or I will say why do we do the prostatic biopsies, is first is rising serum PSA levels. So the normal PSA levels is less than 4 nanograms per ml. Level of PSA rises beyond 10 nanogram per ml, then it is an indication for prostatic biopsy. And if the PSA levels are between 4 to 10, then it is a gray zone. You can either wait and watch and then perform a biopsy, or you can see like if the PSA decreases in the future. Second indication of doing a prostate biopsy is when your doctor feels a lump or growth during a transrectal examination. The third indication of doing a biopsy is when you have been biopsied earlier and the biopsy was normal, but your serum PSA shows an increasing trend. So that is also an indication of performing a prostate biopsy. Now many patients come and they are very concerned that, ma'am, will there be any complications of doing such biopsy, or we should be concerned how the procedure will be done. So yes, there are complications. There are complications of every procedures. So prostate biopsy is also one of them, but the complication rate is very less. So I will say that this is a relatively very safe procedures if done properly. But yes, a few minor complications can be there, like bleeding. Bleeding is a complication which occurs in every procedure. So whenever the biopsy is done, so patient may feel like blood is coming out in urine or in stool or in semen, and it can come for 2 to 3 days, which is very normal. But yes, if this bleeding continues and if it is prolonged, then definitely you should consult your doctor. The second complication which can occur, which is also very common to all the surgical procedures, is infection. So infection can happen, but nowadays, we do the biopsies very safely. We give antibiotics prior to the procedure as well as after the procedure, so the infection rate is also very less. The third complication which patients usually complain to us is they feel that they are not able to pass urine, or they have difficulty in passing urine. So obviously all these complications, these are very minor complications, and they usually resolve in 2 to 3 days. So now I will talk about how the biopsy is being performed. So before the biopsy, before we take up any patient for a biopsy, we usually see a few things like coagulation status. The patient INR should be in the normal range. If the patient is taking any anticoagulant medications, they are weaned off from several days prior to the procedure. Then we have to see the urine test and urine culture. The patient should not have any urine infection, as it will definitely lead to infection post the biopsy, and prostatic infection can be really painful. A urine culture and examination is a must to perform before performing a biopsy. So how we do the procedure? So when the patient is admitted in the early morning, we give rectal enema so that the rectum is flushed off of the unwanted contents, and then while doing the procedure, the patient is positioned on the left lateral position with the knee of the patient touching the chest, and the part is prepared, it is cleaned and draped, and then a xylocaine jelly is inserted into the rectum so that the patient is anesthetized properly. Then the transrectal probe is prepared, and the biopsy guns, they passes through that probe and takes multiple samples of the prostatic tissue. Normally what we perform is 16 core biopsy, in which we take 16 different cores from every corner of the prostate, so that if there is even a minor and slightest of the cancerous tissue, it should not be missed. And then all these cancer cores, all these specimens, they are sent for histopathological evaluation. They are processed, and then the pathologist make a report, and then a grading system is generated, according to which we dispatch the reports to the patient. So after this procedure is performed, obviously the concerns of the patient and what patient asks is कि मैम पेन तो नहीं होगा, और मैम ब्लीडिंग तो नहीं होगी, या फिर इसका और कोई कॉम्प्लिकेशन या साइड इफेक्ट तो नहीं है. So as I discussed previously also, the minor complications which can happen is like there can be bleeding either in the urine or in the stool, or sometimes even the semen. And in the semen, the bleeding can happen and can continue for up to 2 to 3 weeks also, but it is normal. So usually this bleeding will stop in 24 to 48 hours, but still if it is persisting, then definitely you should again see your doctor for it. And the second thing is, like, if the patient is having prolonged fever, then also it is a sign of infection. Then also patient should consult a doctor. But all these, again I'll say, they are very minor complications and they usually do not happen. So prostatic biopsy is a very safe procedure, and anyone who is experiencing a prostatic growth or is feeling their prostate size is increased or the PSA level is rising, they should go for prostatic biopsy. They should consult a doctor, a urologist, and they should get themselves checked. Thank you.